Everyone, today I am going to discuss with you regarding the physical medicine and rehab. It is one of the topic we come across in the rehabilitation. Now, this, we need to know about the rehabilitation team. Rehabilitation team consists of three different group of the members. The first one is your medical team, paramedical team, and the socio-vocational team. The medical team, it consists of neurologist, neurosurgeon, cardiologist, cardiac surgeon, gynecologist, orthopedic surgeon, general physician, general surgeon. Almost all the medical professionals, they come under the medical team. The paramedical team, it consists of five main members: physiotherapist, occupational therapist, speech therapist, nurses, pharmacist, and orthotist and the prosthetist. Apart from this also, there are many paramedical members like biomedical engineers, recreational therapists, and so on. The third one, that is your socio-vocational rehab team, it consists of four main individuals: vocational counselor, vocational evaluator, placement officer, and the social worker. And in the rehabilitation, we have to always remember that the team approach is going to win. So always we have to work in a team. But who will be the head of the team? Okay, so theoretically, and most of the good rehabilitation setup will see the physiatrist, a person from the medical field, will be the head of the rehab team. Okay, now the medicine, it is having a three different component or the part, the different medicines part. Okay, the first one is your preventive medicine, second one is your curative medicine, and third one is your rehabilitative medicine. So in the rehabilitative medicine, the physiatrists, they have a good knowledge, and the physiotherapists are the person who is going to work in detail and give the good results in the field of the rehabilitation. Okay. Now, if we look at the physical medicine and rehab, it is a branch of the medicine which emphasizes on the prevention, diagnosis, and treatment of different disease and disorders, particularly related to the muscles, nerves, and the bones. And basic aim that because of the involvement of these structures, we want to prevent the temporary or the permanent impairment in the body. And American Academy of Physical Medicine and Rehab, it gives a good detail about the this particular branch. Now, impairment is basically any anatomical or the physiological dysfunction. I always give this example that loss of pinna of the ear, it is an impairment. It is not going to affect the hearing, but it is just a cosmetic loss. Loss of conduction impulse in the heart. Okay, if heart is missing a one beat, so it will be just an impairment. It is not any handicap or the disability. Disability means what? The individual is not able to perform the activity, the functional activities which is considered to be the normal for them as per their age, sex, and the physique. So unable to perform the human activities which is considered to be the normal as per the age, sex, and physique, that can be termed as the disability. Handicap, it is of a six different type, like speech and hearing, okay, then locomotor or the musculoskeletal, then there are six different types of like visual handicap and so on, but the most common one is your locomotor handicap. Okay, it is basically unable to meet the societal role, okay, that we can term as a handicap. The vision, mission, and the motto of the physical medicine and rehab, that is to promote the individual's quality of life and the functional outcomes, and through the dynamic team approach. Okay, and the traditional approach, it says that okay, add years to the life. Okay, while the physical medicine and rehab and the physiotherapy concept, it says that in a true spirit, that in the remaining life you remaining add life to the remaining years. Okay, that is the concept of this branch. Now, to achieve this goal, okay, we need a good team approach, and the rehabilitation physicians, they play a good role as a team leader, physiatrist, and facilitate and monitors the work of the other team members, and the like a speech therapist, occupational therapist, language pathologist, and so on. Now, who is physiatrist? The physiatrist is basically expert in diagnosing and treatment of the pain, restore the maximum functional lost through the illness, injury, or the disabling conditions. And like physiotherapists, they also treat the patient as a whole and not only the problem area. And they are the leader from the medical professional side in the rehab team. They basically provide non-surgical treatments, explain the medical treatment to the patient in detail, and give the proper treatment plan, and they work on the treatment, and even they work on the prevention of the condition. Physiatrist can help the patient by preparing a treatment plan, uh, giving us proper work, assigning the work to the different rehabilitation team members, and allowing the broad medical expertise. Okay, this allows the physiatrist to treat the disabling conditions throughout the person's lifestyle. They basically treat the patients or help in the rehabilitation like the amputation, arthritis, back pain, neck pain, radiculopathy, carpal tunnel syndrome, cubital tunnel syndrome, tarsal tunnel syndrome, peripheral neuropathy. Okay, and pain. Whenever the pain comes, okay, we need to identify from where the pain is coming. I always give this example to my students. The pain can be originating from the skin, muscles, ligaments, tendons, bursa, capsule, veins, arteries, nerves, bones, joints. Okay, sometimes it is referred pain also. So the first, if we are able to identify from where the pain is coming, then we can treat the patient in a very better way. So we need to identify which structure is affected. Just suppose the nerve is affected, so we need to identify whether it is a neuropraxia, neurotomesis and axonatomesis, and then start with the treatment accordingly, and then we will see the good results immediately. So treatment is important, but identifying the problem which gives the identifying the cause which gives to this particular problem is very important, and then our treatment will be, the simple technique will work best for our patient. Physiatrists even help in the rehabilitation of the stroke, spinal cord injury, post polio syndrome. Nowadays it is almost eradicated. Okay, sports injury, lymphedema, and so on. Basically, they are expert. They can direct the entire rehab team so that each members will work accordingly, and he will do the monitoring. We will see to that how the rehab team can be more beneficial to the patient. So basically they deal with the handicapped individual, and they help a lot, and the goal is to go for the overall enhancement, maximize the independence of the patient, improve the quality of the life, and always try to make use of the physical, psychological, social, vocational and educational measures of the patient, and treat the patient. So they basically even give the injections also on the trigger points in the joints like the hyaline, in the bursa, especially the hip and the shoulder bursitis. Tendon sheet, if it is inflamed, like in case of the tendon sheet is the covering of the tendon. If it is inflamed, in case of say rotator cuff tendinopathy, even they give sometimes the injections of the different medicines, and even they prescribe the analgesics, muscle relaxants, NSAIDs, non-steroidal anti-inflammatory medications. Okay, even fibromyalgia syndrome, they help a lot, and even they direct if required, and even they give some idea to the patient about the different members, what is their role and how they can be helpful to you. Now, for more details on this topic, okay, I will recommend you to go through 4 websites. The first one is www.apmr.com, that is your American Academy of Physical Medicine and Rehab. The second one, that is your www.physiatry.org, that is Association of Academic Physiatrists. The third one, that is your www.archives/pmr.org, a very good website where you will get the archives of physical medicine and rehab. And the last fourth one, that is your www.acrm.org, that is your American Congress of the Rehabilitation Medicine. If you go through this website, okay, definitely it is going to be helpful to you in the field of the rehab. And I hope this video has given you some idea about the physical medicine and rehab. Thank you very much.